you take minoxidil, you will have more hair growth everywhere. So arms, legs, back. For men, this doesn't tend to be bothersome, but when you're talking about women and hair growth, they don't like hair in unwanted places.
Yes.
As far as our next medication that we'll talk about, I guess we can talk about minoxidil a little bit. Minoxidil is one of the oldest hair loss treatments. It's been around forever. It works, but you'll have people say that you don't want to use minoxidil unless you're also addressing the androgens, and I think that's individualized, like we talked about. Some people want a non-hormonal hair loss stack, which is basically, if you're looking at the long-term efficacy of something, is what you really want to use as your metric. Like, how long is this going to work for this person if they don't do anything else, if they're not using another intervention?
Yep.
So I guess minoxidil, as far as the medication, it can be taken orally, it can be applied topically. It has multiple mechanisms of action, some of which are really interesting. Vasodilation, so it's going to increase blood flow to the scalp area. It actually was originally a blood pressure medication. That's basically an acute vasodilatory response. There's some thought that it may decrease the inappropriate collagen or dysregulated collagen production in the scalp. Type 1 collagen specifically seems to accumulate in cases of androgenic alopecia. And people that have androgenic alopecia will tend to have a thicker scalp because of that collagen deposition over time. The dose is studied. It has been all over the place. You could see early studies as minoxidil was as low as 2%. Now 5% is pretty much the standard, and dermatologists quite frequently will to have even women use the 5% just because it's much more effective in a topical form.
Of note, minoxidil can be absorbed systemically, and you can detect it in the serum. I think a good rule of thumb is 5% minoxidil twice a day, applied all over, is going to accumulate in the serum about as much as 1 to 2 milligrams of oral minoxidil, and that can affect serum prolactin. So I guess it's somewhat hormonally active. Depending on the person, could be a clinically significant effect or not. And then, as you mentioned, there is a genetic response. So some people get their genes checked for this to see if they'll respond to it. Some people take it with tretinoin to improve the response, although we'll get more into tretinoin and corticosteroids with minoxidil later, because there's certainly downsides to that as well, as there is with anything else. So I guess in general for minoxidil, we give that a Norwood 1.
Yeah, Norwood 1. It's not a perfect treatment, but it is a fairly good treatment. Doses that we prescribe and doses that are studied, topical is all over the place. Oral minoxidil has been something that has been studied and has gotten more attention and has, probably 3 or 4 papers that, good efficacy. Tolerability varies from person to person. You do have a higher risk of side effects when you're taking the oral minoxidil because you're getting a much higher systemic exposure. And as you refer to the sulfyltransferase, this is something that may be a better option for people who are, non-responders to topical minoxidil, or who are just not going to apply something to their scalp for the next 10, 20, however many years that they want to have that extra growth. So oral minoxidil has been studied anywhere from 1/4 milligram all the way up to about 5 milligrams per day is the highest that I've seen with good efficacy. I know some people are taking it prescribed off-label at even higher doses, but I think 5 milligrams has some pretty good data to support the safety at that dose. And sometimes you may not even need that much. You could do something like 2.5 in between. So this is something that you look at the patient. Do they tend to have a softer blood pressure? Are they more likely to have side effects? Do they already have some fluid retention at baseline that could be worsened, or hair growth in inappropriate places? So you take minoxidil, you will have more hair growth everywhere. So arms, legs, back. For men, this doesn't tend to be bothersome, but when you're talking about women and hair growth, they don't like hair in unwanted places.
Yes. That's a good way to look at it. It can also be potentially useful for beard growth. There's different beard growth protocols. Perhaps that's a conversation for another time.
Yeah, many people have noted that anecdotally, and there's some interesting things going on in the Reddit sphere, as always.
Yes.
So, minoxidil, and go ahead.
Couple final thoughts on minoxidil. After your first 6 or so months, you've gotten most of the benefit, or most of the like transformative benefit from minoxidil. So changing to a less frequent dosing, like once a day instead of twice, or changing to oral instead of twice a day, can improve your quality of life from like a not having to do a twice a day topical regimen standpoint. And then also microneedling in particular, again, as Alec McCarthy mentioned, is synergistic and combines well with minoxidil treatment.
Yeah, and we have some studies that we'll get into when we go to microneedling, but basically this is the durable effect is what I was alluding to earlier when you say, okay, well, someone doesn't want to use anything hormonal. Is minoxidil just a waste of time for them at a certain point? And this study here that we're looking at, it doesn't seem to be the case. It seems like even at 5 years, they're still above their baseline hair count. Mm-hmm. So if I have androgenic alopecia, I know that if I don't do anything, then on average, I'm going to have a trend downwards in hair density, vellus hair count, all those sorts of metrics. Mm-hmm. But if somebody starts on minoxidil today, 5 years from now, on average, they're going to have more hair then than they do right now at this present moment. Mm-hmm. So I think that will, buy people a bit of reassurance, mm-hmm. because if you say, well, I certainly can't get a hair transplant right now,
yes,
I can at least buy some time over the next 5 years, provided that I tolerate minoxidil well, and then I know that I'll still be ahead of where I'm at now. Mm-hmm. So, I think that's something that we look at when we look at like long-term efficacy. So very few and far between as far as studies that are looking at something cosmetic 5 years out. But this one here seems to show that there's a durable effect.